Good morning, colleagues. I would like to call this meeting of the Finance Committee to order. And as is our custom, we will begin with a prayer in Finance Committee. I call upon the Minister of Education to lead us, please.
Let us pray. Our kind and precious Heavenly Father, we want to pause to acknowledge who you are, the great I am. We want to thank you for the privilege and honor that you have so generously bestowed upon each representative here, each member of auxiliary staff, our technical staff, with endued wisdom to carry out the high offices in this country. Lord, we pray for our country on a whole today. We pray that you would continue to guide and protect. And Lord, as we begin the considerations and the varied deliberations in Finance Committee today, we pray that we would do it in a way that would exalt your name and from a holistic approach that would enhance the lives of all of our people here for future generations to come and for the current enjoyment. These mercies and favor we ask with anticipated blessings. Amen.
Amen. Please be seated. Good morning, honourable members of the committee. We do have a quorum, and so the committee is properly constituted in order to commence this meeting. We have had apologies last week, Friday, from the member from Georgetown Central, and we've also had the member for West Bay South has indicated that she will be here later. She had a matter that she needed to, personal matter that she needed to deal with quite urgently this morning. Members, the quorum of Finance Committee is 10 members, excluding myself, the chairman of the committee. The purpose of this meeting of Finance Committee is to consider the items shown on the hard copy of material that has been distributed to all honourable members. The committee's approval for these supplementary expenditures is being sought under Section 12 of the Public Management and Finance Law. Such a procedure, honourable members will recall, was done, I think it was last August, in August 2017, when additional expenditures were approved for NGS 55, tertiary care at local and overseas institutions. Given that government must conclude Finance Committee's proceedings today, since honourable ministers of government are travelling overseas from tomorrow onwards on official business, I ask for all members' cooperation in asking their questions promptly and not making long introductory remarks before stating their question. When it comes to taking a vote on the individual items in the Finance Committee agenda, I shall ask all members' positions on a particular item by posing the question. All those in favour of, and I shall state the name of the particular appropriation and its amount, being approved pursuant to Section 12.2 of the Public Management and Finance Law, please say aye, and those against, no. Just to give the listening public a preview of the supplementary expenditure requests that the committee will consider today, here are the main areas that will be examined. First, an additional $8 million is being sought to assist with medical tertiary care at local and overseas institutions for indigents, seamen, and veterans. Secondly, an additional $10 million is being requested to make important land acquisitions that will protect and preserve the environment. The committee will also be asked to approve the use of monies in the Environmental Protection Fund to acquire these properties. And three, a net increase of approximately $1.9 million to help the most needy members of our population through programs such as poor relief vouchers and rental accommodation for persons in need. Honourable members of the committee will quite rightly ask, what is the financial impact of these requests? I direct your attention to page 8 of the Finance Committee agenda material wherein it shows the financial impact of these requests. These are incorporated within the column on the table on page 8 that gives a current forecast for the 2018 financial year. Honourable members, I can say that none of our FFR ratios that the government is required to comply with are in danger of being non-compliant. We shall now consider that the first item on the agenda that requires the approval of the committee. An additional $8 million is being sought to assist with medical tertiary care at local and overseas institutions for indigents, seamen, and veterans, found on page 4 of the agenda material before the committee. Before we open this up for questions, I would ask the Honourable Minister of Health if he has any remarks that he might like to make before we examine this appropriation.
Thank you, Mr. Chair. Mr. Chairman, I'd like to take this opportunity to apprise the members of Finance Committee of the requested supplementary appropriation for the Ministry of Health, Environment, Culture and Housing in the 2018 financial year. In June 2018, Cabinet granted and approved for an increase of $8 million for the NGS 55 tertiary care at various local and overseas institutions. Mr. Chairman, the approval for the increase in the NGS 55 is pursuant to Section 12 of the Public Management and Finance Law 2018 revision. Under NGS 55, indigents, seafarers, and veterans are provided tertiary medical care at various local and overseas institutions based on referral by the Chief Medical Officer who is stationed at the Health Services Authority. The additional funding for NGS 55 is to increase the allocated funding for the current financial year in line with the projection of expenditures based on the year-to-date claims experience. Members may be aware of similar requests for supplementary funding in prior years for the NGS 55. The budget for this program continues to be inadequate for the growing need and the escalating cost of overseas health care. NGS 55 covers the non-HSA care for the indigents, seafarers, and veterans, and the number of individuals covered has been increasing annually. For example, the number of indigents has increased from 1,101 in November 2011 to 1,610 as of 31st of May 2018. This is a significant increase in individuals being covered, which naturally translates into increased costs. Of the 1,610 individuals, 907 are on the indefinite or permanent list, and 703 are on the temporary list with specified end dates. It is interesting to note that the age cohort that makes up nearly half of the individuals on the indigent list, temporary and permanent, are those aged 61 and over. In the permanent group, 626 of the 907 permanent indigents are aged 61 and over, representing nearly 70% of the permanent indigent group. With such a significant percentage of the indigent group falling into the 61 and over age group, I am further convinced of the need for my ministry to undertake the feasibility study looking at healthcare needs for older persons to get some empirical information relating to the types of healthcare services that should be available for older persons and to make some recommendations on the possible ways to provide services that are affordable and sustainable. Mr. Chairman, members may recall that the health insurance regulations were amended in 2013 to double the health care insurance providers' contribution to the segregated insurance fund, which is intended to help cover the cost of health care for the indigents. This fund is forecasted to collect close to $5 million per annum. However, this is still significantly below the government's cost of providing health care for the indigent, seamen, and veterans, which averages approximately 1.8 million per month for the NGS 55 output for local non-HSA and overseas tertiary care. The government spends an additional $1 to $2 million per month for the care delivered to these individuals by the Health Services Authority. Mr. Chairman, delaying or denying necessary medical care for the indigents, seafarers, and veterans presented a significant liability to government. In the event that a patient's referral is not actioned due to the budgetary constraints and their condition deteriorates, there is a high probability that the patient or the family would file a lawsuit against the government. There are human rights concerns that need to be considered as well, given that the Bill of Rights under the Constitution is now in effect. Further, the inability to pay overseas providers of medical services already provided for indigents, seafarers, and veterans could result in lawsuits against the Cayman Islands government. An inability to meet financial obligations to the overseas healthcare providers in a timely manner could affect the relationship with these providers, whereby patients referred by the government could be denied access to critical care. This has the potential to affect not just the indigents, seafarers, and veterans, but the entire civil service body, and may have an adverse effect, may have an adverse impact on the public service. It is therefore my hope, Mr. Chairman, that my colleagues in Finance Committee will support this request for the supplementary funding. Thank you, Mr. Chairman.
Thank you, Minister. I now open the floor. Are there any questions on NGS 55 for $8 million?
Yes, Mr. Chairman. Mr. Chairman, I guess the first question would be, it appears to me that this additional $8 million in funding is only for the financial year 2018. Right, okay. In numbers just given by the Minister of Health himself, at 1.8 million average per month, that's 21.6 million per year. So where is the other money coming from? Or is it that we believe that this 8 million can take care of the 6 months that is left in this financial year? And
Yeah.
I know.
Thank you, Mr. Chair. The $8 million is projected to take us through the rest of the year based on reports from Cynical.
Can the minister confirm that the 21.6 million, based on the figures in the statement that you made for 2018, is likely to increase substantially for 2019 because of increased costs in medication?
Mr. Chair, as the number of indigents increase, we've seen a rise, a slight rise, although it's been consistent in terms of the amounts, supplementary amounts. And because of this, there will be an increase Can't say how much, but we expect an increase, and this is why, as stated here, we need to do a comprehensive review to see what we can do differently to try to sustain, to bring the cost down for this book of people, the indigents, seafarers, and veterans, and I must remind people that 80% of our costs is by this 20% group.
Impossible. Impossible. Anyway, does the minister have, he gave the numbers in 2011, I think it was, or 2012, of indigents. Does the minister have the numbers for 2017? How many people were in the indigent category in 2017? I've been saying it for years. And pension, one.
Mr. Chair, if the member would allow me, I actually have the numbers month by month. 2017, the indigent list.
But that don't serve no purpose, because somebody in January could be the same person listed in February. I have no way of knowing, unless you can tell me how many new people were added February over January. The monthly figures mean nothing.
Well, before we go there, I could state what we have and undertake to get the rest. In January 2017, we're showing 1,399, and in February, we went to 1,431. March went to 1,446. April 1,479. May 1,507. June 1,524. July 1,530. August 1,552. September 1,544. In October we had 1,576. November 1,608, and in December 1,585. So it's almost an increase every month.
Except for December, it went down.
Member for Savannah, you had a question? Newlands. Oh,
If
okay.
unfinished question then?
But-
No, sir.
Okay, you just
Oh, yeah, I
indicated
can-
he had a question.
Yeah, no problem.
Okay.
Thank you, Mr. Chairman. I have always tried to stay away from this and situation, having spent time there myself. But, Mr. Chairman, through you, 9 short years ago, when we had this same situation, we had an appropriation between $3 and $4 million. This is mind-boggling, 7 times the amount. What we did, and my question is, what is being done to manage we went to the seamen, which was by far the biggest majority, and the veterans. There were incentives that were put in place and a special management of this entire budget. And one of the things that we did was ask the seamen and the veteran to absorb 10%, which caused them to really look before these referrals were done overseas. And as I said, my question on this, Mr. Chairman, what is being done to manage this? What incentives, what ideas are we looking at? Because we cannot, there's, this amount of money is just absolutely phenomenal. And I well know, having had to go through it with my family and other members, the cost of medicine, which is skyrocketing around the world. But what is being done, one of the other incentives was some of the people went to Jamaica and were glad to go to Jamaica when they saw the service and the cost as opposed to going to the United States. Of course, we now have Health City, which is contributing and reducing a lot of this. But I am encouraging the minister and his staff to look at ways of dealing with this in bulk. We cannot continue this.
Mr. Chair, I can tell you that I join in concert with the member from Savannah, and I can tell you that this is one of my pet peeves. And as I got into the office, as I got elected, one of the first things that I undertook was trying to find a way to curb the costs when I saw the numbers on this. And I have been meeting with persons from overseas and local and all over, trying to find a way with the ministry and other persons coming overseas from large organizations, trying to find a way. We can't, and you're right, we cannot continue. This will only rise, and that we cannot continue paying this kind. And we need to find some way to stem the tide on the rise in this cost for this group. And there has to be a way. And I can tell you that and the ministry, chief officer definitely can tell you that this is one of the areas that I have been working on, trying to find a way. There are some possibilities, still in the embryonic stages of discussion, but I have 3 years left, and I can tell you if it's not even achieved, at least I'll be putting a lot of ideas on the table for the House to digest.
Member for Northside.
Through you, Mr. Chairman, the minister reiterated the government's policy to seek to do a separate health insurance plan for people over 60. Is there any other policies in place that may affect this cause?
Mr. Chair, there's some initiatives that have been put in place by Cynical and the ministry in terms of Jamaica First and trying to utilize whatever hospitals on the island that could manage that tertiary care. I think the member from Northside probably needs to rephrase, just repeat the question for me, please.
The question is, are there any other policies in place in the ministry that will have a positive effect on reducing this cost other than the one where we're going to do a healthcare plan for persons over 60?
They've always been the Jamaica First initiative by Seneco but as we know, and if you want to be truthful, that doesn't necessarily work all the time, and that's not Cayman's first choice, and they call us as the politicians. And we know what happens next.
Member for Bodden Town East.
West.
West. I got it.
Thank you very much, Mr. Chairman. I'm looking at page 4 and 5 of the the statement, where it says on page 5, reading from page 4, over there is still significant below the government's cost of providing health care for the indigent, seaman, and veteran, which averages approximately 1.8 million per month for the NG55 output for local non-HSA. So that 1.8 million per month is 21.6 million annually. And then it goes on to state, the government spends an additional 1 to 2 million per month for the care delivered to these individuals by the Health Services Authority. So that roughly is another 18 million and change thereabouts per year. So we're talking about spending $40 million a year in healthcare costs, but then we're only collecting $5 million from the fund, which is actually what the private sector individuals who are covered, that's part of their costs. The question in all of this, Mr. Chairman, there's clearly a $35 million a year short between the segregated fund and what it is that the government is paying based on what is presented here today. And the thing about it is, when I look back and realize now that 6 months into the year, that the budget number was 73% off from 10 million to what it is that we're looking now halfway through the year. The question is, what is going to be done to deal with this $35 million a year shortfall? Because this, in essence, Mr. Chairman, is unsustainable. And if we have a problem, if we're 35 million short this year, chances are we're 35 million short next year. And if this is a growing problem based on the list, the number of indigents that we see that was from month to month listed by the minister. What is the plan? Just putting it in numbers to deal with this 35 million short.
As I've said, this is very concerning to me also. It's something that came in and found, and I want to be the minister, along with this government's support, that finds some kind of remedy to stem the tide, sustain this cost, ever so rising. And it seems, I'm a bit uncomfortable with it, as I must say, as minister. It seems like we're very happy to report that it's the same thing that we did last year, and the same thing we did the year before, and I'm very uncomfortable with so in knowing that I'm uncomfortable, and I've reported this to caucus quite a few times, and we've been trying to find ways to to sustain this cost, we've been having some conversations that I really don't want to divulge right now. But I can speak to you all privately on some of the initiatives that we're trying to do to try to curb the costs and to try to have something more budgetable instead of having this rising, out of control, unknown. This is, as I said, this is a pet peeve of mine, and I intend to put some suggestions forward to the caucus before the end of this year. I've been working on it almost a year now, and I think there are some things that can work other than what we're doing. It seems like everything is all over the place. Everyone is, the Cynical is doing something, the HSA is doing something, and it's all over the place, and we need to bring it to one home, to one place, so that we can manage it much better. There's no pride and joy in sitting down and talking about this out of control spending for this very worthy group of people.
Mr. Chairman, sorry.
I do have, okay.
Sorry, just a quick
Continue.
follow-up.
Then I'm going to go to member for East End before I come back to you, member for Northside.
Okay, just a quick follow-up. And I'm just going by memory here. During our time when we were looking at SEMA's annual report, and sorry I don't have it here with me, but I remember the profits in the health insurance industry per audited financial statements that were submitted to the Cayman Islands Monetary Authority, which regulates that industry. We saw healthcare profits move from 14.8 million one year to 51.5 million the other year. And briefly, I think with the last report I was tabled, the profit again is around, I think, in excess of 20 million for maybe 2016. So 14.8 million, 51.5 million, and I think over 20 million, because we haven't got a chance to look at that yet. And what it is that scares me is that when we look at this older person's healthcare plan that's been looked at, the whole purpose of insurance is to spread risk. And what I'm scared of is that we keep going back to the taxpayers of the country for money when we see we have a law that says if the healthcare, if the HSA doesn't bill within 180 days, you can write it off. The insurance company is off the hook. And in some cases, people's medical treatment is far longer than 180 days. During the same year in which 51.5 million was reported in profit for the health insurance industry, again speaking from memory, HSA's bad debt went up like almost close to $30 million during the same period of time. So it can't be a situation where, and to put it in a question, it can't be a situation where we have the health insurance industry making $50 million and $20 million profit on 40,000 working people, and then the taxpayers of the country is left. Because the issue comes up, and why this is going to be a growing problem, is that as soon as someone retires, I get to the question, from the private sector, they becomes government problem. So the question is this then, at what point are we, and I'm not going to say the government, because this is all of our problems now, the question is, at what point do we put our foot down and say enough is enough and look at moving into a national health insurance system? 35 million short this year, is 35 million short next year. It's $350 million in 10 years. When the health insurance industry is going to make around, at the rate they're going, 300 million profit during the same period of time. So the question is, when do we put our foot down to say enough is enough?
Okay. Minister?
I can tell you, and I thank you to the member from Bordentown West. This is some of the things that we discuss in caucus. National health care insurance versus trying to expand the remit of cynical. And we're not, I can tell you, we're not sitting idly watching it go by. This is really something that, as the member said, all of us need to pay attention to. I'm paying attention. Paid attention ever since the report came out, and that's why I also asked for a review of the children's national health policy in terms of free health care for children, because we can't have all this profits being made on the backs of the people of this 40,000 as said workers and the people of this country have to suffer with large insurance bills, and everybody takes home their profit. It's definitely something that we're looking at. Well, thank you.
Member for East End.
Thank you, Mr. Chairman. Mr. Chairman, I believe that the last Synico's financial report last week, showed a loss of only less than 2 million. So it's obvious that Synico is doing something well. Of course, they're being paid by government. We understand that. But it looks like they're managing pretty good. It's time to expand Synico now. It's time. Mrs. Chairman, sorry. The member from Northside asked about other initiatives to try to stem this glut of our financial industry. Mine is in line with that. We understand underestimating a budget because we don't know who's going to get sick. So we can have some justification for at the budget time we underestimated what it was going to be. However, herein the problem I am finding is, or the question I want to know, the answers I want to know is, what is it through incompetence at the HSA or fear from the professionals from getting blamed why they're referring these things to tertiary care? Are we as capable, i.e. professionally, equipment-wise, everything at the HSC so that we can diagnose these things and contain them? What has any study been done? This is one of those initiatives I think would be a good one. Has any study been done to see how much of those tertiary referrals could have been handled at the HSC?
Mr. Chairman, these are the drill down, and it's not easy. It's not always easy trying to get the answer, I must admit. These are the drill down questions that we need to ask, and I agree with the member. This is one, as I mentioned earlier, Synico as an idea to expand Synico, and I can tell you that I'll just mention one small thing that I noticed, and we're not just sitting by. The difference between ultrasound and a CT scan, and I stand to be corrected, but I almost want a daily report of the usage of some of these equipment and referral procedures and so forth, because I'm not comfortable. I can tell you that the difference between an ultrasound and a CT scan is one's $200 and one's $2,000, and so I see these things, I question them, and want some resolve in trying to keep it. There's things that can be done. There's things that can be done from what I've seen thus far, and more studies needs to be done that we could keep the cost down just here alone at home. But I take the member from East End's question very serious in terms of persons being referred overseas, and I hear all the time, and you all know me, I'm a straight shooter, about finding these establishments overseas that give us a great discount. But discount on what? Discount on the highest price. So there's a lot of things we've been looking at. It's not an easy puzzle to solve, but I can tell you I'm on it, and hope to resolve it, to at least put it in the reverse position, at least a start, to reverse the trend in this upward rising of costs.
Mr. Chairman, if I may just follow up, sir. In his introductory remarks, the minister spoke of the three categories: indigent, seamen, and veterans. I think it was that this money is for to I don't want to have repeated, you see, to support their medical overseas staff. As I recall, seamen, for many years now, and the Minister of Education may be able to verify this, have been paying their contribution to Synico for their insurance, which was my understanding allowed them the right to go and covered them for overseas tertiary care, part of it anyway. How does that relate to the additional cost now in those three categories? Why are we, if they're insured by Synico to cover those costs, and if they're not, then that's a different matter, but my understanding was that they were, or they are, and how does that relate now to us seeking additional funds to cover their tertiary care overseas? The seamen, that is now, seamen. Because they have said on more than one occasion publicly that they pay insurance, and I know of people in my family who pays that insurance as well. So how does that relate in relation to us now seeking monies to cover those tertiary interventions?
Mr. Chair, I beg your indulgence in asking my chief officer to answer that question, please.
I think you can do that. We did it before. Huh? Huh? Yeah. Please proceed. For the record, though, Chief, would you mind stating your name and position?
Sure. Good morning. Jennifer Hearn, Chief Officer in the Ministry of Health, Environment, Culture and Housing. In regards to the member's question, the situation for the seafarers and veterans is slightly different from that for the indigents. The seafarers and veterans are covered under the Ministry of Finance, has an output for their HSA care, which I understand is done on an insurance basis for that. And anything outside of the HSA for the seafarers and veterans is what comes into the NGS 55 output. So the Ministry of Finance carries the cost of that insurance plan for their HSA care. NGS 55 is what covers everything outside of the HSA. I'm not sure what the arrangements are with Synico and the seafarers regarding the contributions that the seafarers make, and perhaps the Ministry of Finance can speak to that for their local care. But I am aware that in the past, the contributions that the seafarers had made has been used by the seafarers to assist their members with things like travel costs or out-of-pocket costs associated with their care. But I'm not sure what the situation is currently.
Mr. Chairman, that may be the case that insurance that I was aware of is only for local, because that's what I'm understanding now. But certainly, Mr. Chairman, one of the initiatives that I would implore the minister to address and pursue would be to pay for the insurance for the seamen to go overseas as opposed to paying it directly out of this. It's got to be cheaper. It's got to be cheaper than if there's a tertiary care of $1 million because a seaman got sick and we're paying for it. It's got to be cheaper to contribute additional monies to Seneco to cover for that insurance. That's the kind of initiatives we need to look at to stop this glut.
I don't want to get too deep into it, but as I alluded to earlier, I've been meeting with some organizations in terms of doing that very thing in terms of getting this cost to go down. And I've had some agreements verbal agreements from some organizations that they would do whatever they could to try to assist the government of the Cayman Islands. And this is not only well, so, and I guess the agreement would be very clear. Of course, these things take time, as you all know. But from what I heard from the committee is that the appetite is to increase the ambit of cynical and to Yep, and it's something that we've been talking about. Of course, we need to ensure that the right mechanisms is in place to achieve what we're what we set out to achieve in terms of cynical. We don't want a situation that doesn't work. But definitely, I think we're on the same page, and I think as a government, as the 19 persons elected, this bothers all of us, and we need to find some concerted ways to stem this cost. There's no way that we should continue accepting that this is the norm. I can tell you all that I'm very uncomfortable, and I would never sit down here saying that I'm comfortable with the current arrangement. And I can tell you that the caucus is not comfortable either, because I have to go to them and beg their approval for the supplementaries, etc. It's not a comfortable situation, and I am doing all I can, meeting with persons on a weekly basis, overseas companies, local companies, trying to find a way, and there must be a way.
Mr. Chairman, just to say that expansion, Mr. Chairman, of the remit of Seneca's full authority should also include statutory authorities and government companies, because there is strength in numbers and you will get better coverage for all government employees.
Member for Northside.
Through you, Mr. Chairman, some years ago, the Cayman Association donated a robotic instrument to the hospital, which can be used in many cases as an alternative to physical referral overseas. What is the government's policy in the use of that piece of equipment?
The robot. What name? Robot something. Old or stroke.
I would allow the chief officer,
Telemedicine.
say Ahern to answer, if you will allow, Mr. Chair.
Thank you, Mr. Chair. Through you. The government recently revised or added the codes for the telemedicine to the standard health insurance fees. I don't remember the date when it was done, to facilitate increased usage of the Sally robot. My understanding is that the team at the Health Services Authority do use it as is applicable and as when it's called for, and that one of the primary uses of it is to do with stroke protocols.
Through you, Mr. Chairman, can the minister, given the answer just given, can the minister justify the underutilization of this piece of equipment?
I really don't know why they're not using it as often, but I undertake to find out. I believe it could be used more.
Mr. Chairman,
Member for Newlands.
just going back to the whole idea of a national insurance plan or coverage. Has any work been done, any assessment, any sort of analysis been done that would help to start building a business case? Because you can't make this move without obviously having the information to make the decision. Has any assessment been done so far comparing what obtains now versus what is being proposed, so that could guide your discussions and your policy going forward?
The answer in short, Mr. Chair, is that there's not enough work done to be able to justify the route of national health insurance right now. But it definitely, whether it's national or whether it's expanding cynical, which may be two different things, definitely something has to be done. There's every year we continue coming and for this NGS 55, and it's the responsible thing for us to do as a house is to look at ways to stem this cost, and we need to look at all options.
Okay. Member for Bodden Town West.
All right, Mr. Chairman, thank you. Mr. Chairman, I will say, one, I'm going to vote for the increase because it is needed. But what I would like, and this is the question to the government, we need the government, is the government intend to at least commit to look at expanding Cineco? I know it's something that's under your remit, Mr. Chairman. For the simple fact that, one, when I think about people moving from job to job and sometimes have to change insurance companies and have pre-existing conditions and everything else, in the absence of a national health insurance system where we do have a government-owned entity that offers insurance, is the government at least willing to give a commitment in terms of expanding Cineco? Because, like I said before, the 35 million shortfall every year is unsustainable. And the whole idea behind insurance is to spread risk. And the model that we have right now is going to lead the taxpayers of this country to turn off the lights every single year. So is there that commitment to at least expand Cineco to offer a broader range of insurance coverage?
Mr. Chair,
Go ahead, sir.
I don't. I think what the member meant to say is that the undertaking to look at expanding Cineco.
No. We're past looking. We need to actually do something about it, because next year's another 35 million, and in 3 years you're talking $105 million shortfall.
What I can say is, in my capacity, because since Cineco does fall under the Ministry of Finance, is that we are now looking at that and ways in which it can be done. Myself and the Financial Secretary recently had some discussions about it. So the idea would be to do a study to understand how we can accomplish it, how it needs to expand, and also consider a lot of the regulatory aspects of it, because Cineco would need to be recapitalized further to enable it to expand its operations, and as well as premium setting, everything else. So it is an issue that we are looking at and moving forward with.
Mr. Chairman, thank you, because considering 3 years, we're talking about $105 million shortfall. I think it would be cheaper at this point to capitalize Cineco.
Yeah. Member for Savannah.
Thank you, Mr. Chairman, and this is directed to you, not to the minister. And you just briefly touched on it, which was pleasing to my ears. As you remember, when I was in caucus there some time ago, that your predecessor advocated this strongly, but it seemed that there was heavy resistance from the authorities. It is time to put your foot down, even if you got to give them some more benefits, to cut the stench of flow of blood that is coming to the people of the Cayman Islands. And I would urge you, sir, and your government to do what you need to do, because this would dramatically, I think, because of the volume, as all of those know within insurance, would reduce those premiums. Bring these people on board, whether they like it or not, whatever fancy plan they have. It's time to put your foot down, sir. Thank you.
Well, thank you for your comment. And what I would say to you, I'm fully aware now, because I have all the information of what was done previously by the previous minister. And that is now going to be used as well to help inform us with the way forward and how do we get there. Member for Northside.
Through you to the minister, can the minister say what is the minister's policy on the sale of medications at the HSA?
Mr. Chair, I don't have that information available. I would have to send it to the member in writing.
Is the minister aware that the pharmacy at the HSA is using 100% plus markup on medications? I told her this on the budget address and I wasn't listening. The numbers in the budget. And through you, Mr. Chairman, I am uniquely aware of a patient who recently had treatment in a tertiary care institution, and the medication prescribed for that patient, the HSA priced it at $2,000 per month. And the patient was able to buy from the pharmacy within the tertiary institution where they were treated 3 months supply for 10% of that cost. I would also suggest to the minister that he look at the policy within the HSA rather than buying medications, particularly medications that are not cheap, from wholesalers or manufacturers. They are buying it from local pharmacies at retail price.
Mr. Chair, definitely alarming. Definitely need to look into this situation. I was not aware, and I thank the member from Northside for present this house. But very makes me very uncomfortable, and there's so many fires to out.
But through you, Mr. Chairman, that raises a wider question, because how can it be that the minister or the ministry, the minister has not been informed and is not aware of these kind of things are happening when those numbers are in the budget that the minister brings here, that was passed in December last year?
Mr. Chair, as I mentioned just now, a lot of fires to out. And I'm plugging away and trying to do the best that I can with the support that I have. And I can tell you that I intend as Minister for Health, Environment, Culture and Housing to make a difference before my term ends.
If there are no further questions, I put the question. All those in favor of an additional $8 million of expenditure being incurred in 2018 financial year with respect to NGS 55, tertiary care at local and overseas institutions, being approved pursuant to Section 12(2) of the Public Management and Finance Law, please say aye.
Aye.
All those against, no. The ayes have it. We now move on to the second item on our that we're seeking appropriation for. That is, we're seeking appropriation for land purchases of up to $10 million as found for EA4 land purchase, $10 million. Would ask the Minister of Lands if you might have an opening statement to give to the committee.
Thank you, Mr. Chair. By way of reminding members, there was an allocation of $300,000 in 2018. That was for the second installment payment for the acquisition of the adjacent beach property to Colwood in Bordentown. Hence, there is nil remnant into EA4 at the moment. The government being responsive and cognizant to the need of preserving environmental sensitive properties within all of the districts, and in addition to ensuring that there is an adequate access and ownership to beach properties in all districts. We have taken the decision and also intimated to our friends across the aisle of the decision to increase this vote with the consent of the Honourable House to $10 million to allow the government in this financial year to increase the ownership by way of crowned ownership of additional beach properties. We're fully cognizant, Mr. Chair, that this is a one-time effort and there is no way that it can purchase every single desired beach property, but we believe that to delay is not in the best interest from a holistic standpoint of the country. Members would recognize that in the last administration, we were successful in bringing the public's authority law, whereby we were able for the first time to produce reports documenting various access points throughout the island. And we are of the opinion, Mr. Chair, that today, if this vote receives a positive assent, it will be a historic movement where both sides would have an opportunity to agree in the interests of all of our people to acquire this additional beachfront property and environmental sensitive property. We realize that there has to be a delicate balance between development, environment, and the need for our people to enjoy what is heritage. I don't believe that there is one red-blooded Caymanian who does not enjoy the beautiful waters that surround us and the beautiful white sand. But as development has come, and I must say, despite what is being said in many public arenas, nobody forces anyone to sell their property to the developers. Those proprietors sell it on their own free volition, but I believe the government at some stage, and we believe that today is the relevant stage, must take that high approach and to look not just for the current needs of the country, but for future generations. And we believe that this will not only be historic, but we believe will be positively setting the policy for not just this government, but for future governments to come, that as far as possible, every single district should have a minimum of one, and where possible more, beach access and beach properties to be purely and fully and holistically enjoyed by all of our persons here in this jurisdiction. Thank you.
Thank you, Minister. Are there any questions with regard to EA4?
Yes, Mr. Chairman.
Member for Northside.
Through you, Mr. Chairman, I think it was in the last financial year we approved $6 million from this fund to purchase land for environmental purposes, i.e., as I understood it, under the National Conservation Council to do protected areas. Has any of that land been bought, and how much of that $6 million was spent?
Mr. Chair, I am not aware of that. I'm not sure whether your ministry could assist with that. That was for National Trust, and I don't believe that actually.
No. National Council.
National Council, which doesn't actually fall under my ministry. It falls under the Department of Environment. I know I was here, but so were you. I mean, all I'm saying, member, with the greatest respect, is that it did not fall directly under my ambit. So I can do one of two things. I could ask the ministers responsible and their technical staff if they wish to supply the information, or I would do the courtesy to request it and supply it back to the House. But I don't personally have personal knowledge of that.
That's why I could afford to tell you you were here, because I was.
So does that mean you know the answer, sir?
No, I know it was approved.
Member for Northside, I think I can elucidate a little bit on your question.
Okay.
But I think the Environmental Protection Fund at the beginning of January of this year had a balance of $56 million. It is going to receive interest and transfers in of about $7 million. And the interest will be transferred out to the general revenue. And it includes what you were asking about specific, the $6 million. It does include it in the 2018 financial year. So there is provision for that $6 million to come out, which would take it down to the $55.8 million. And if the $10 million is approved here today, would take it out to $45.8 million.
Has, and again, I don't know whether you're aware or not, so the $6 million has been rebudgeted for drawdown in this financial year. So none was drawn down in 2017. Yeah. Because I don't remember it being reauthorized.
what we would can try to undertake is to understand what may have been budgeted for 2016-17. I don't have that information available, but I can confirm that 6.1 has been approved to be drawn down in 2018.
But the question I'm asking, was that 6.1, the 6 million that was approved for the 2016 budget, or is it allowed to be carried over if it wasn't drawn down within the financial year?
No, sir.
Would it have to be reauthorized?
Anything that is approved in 1 year that's unspent, the authorization ceases at the end of the fiscal year, and it would have to be reauthorized. It would have to come back again for authorization in the following fiscal year. So, I know what you're asking, but I don't know if it really was budgeted in 2016-17 fiscal year, and we'd have to check that and get back, let you know.
Do we
Mr.
have-
Chairman, as far as I'm aware, recall, it was budgeted during the tenure of Wayne Panton. It has not been reauthorized by this legislature. Not for this one, which was the budget in November.
Yep, but when I know, but I'm looking at the numbers here, that it was approved in November to come out in 2018. Now, whether it relates to the same figure we're talking about, it's a different amount,
But-
I'm not sure. We need to find out what happened, what the story is.
Can we determine that and resolve this matter before we go on any further, Mr. Chairman?
Mr. Chairman, I believe we take a short suspension between your section, my section, and Minister Seymour's section. We should be able to. I know that I don't know the amount, and I'm not sure of the exact vote without having that conference. But I know on the very last cabinet of the former governor, there was a tremendous amount of property that was bought and transferred to the National Trust, which would have brought it within that 18-month budget period. So once we could take a break, so we don't mislead the House in any way, and we have another furor, I'd like to have an opportunity for all three vested parties to have a conversation.
Let's take a 15-minute suspension then so that we can confer.